How to think like a prosthodontist. One thing that I learned in this class about prosthodontics is that you have to keep your options open. You can't be closed-minded about techniques on how to accomplish a certain procedure. You have to be willing to be able to explore new options to solve new problems, because essentially every patient that you're going to be seeing will be a new problem and should be addressed differently than the patient before. Each patient's going to be unique. They're going to have unique anatomy. They're going to have unique situations. So it's important to be able to look at a patient and not get discouraged, yet you should be able to look at them and think of ways that you can help them to improve their oral health and to help them have a better quality of life and living. And essentially, if something doesn't work out, try it again. It's okay to fail, but it's always important to not give up and to keep trying. And I learned this when I was making my spaghetti denture. I decided to try and use candle wax, but it didn't work the first time. And I was kind of having a hard time deciding how I wanted to approach it. But I kept looking for options, and I found an option that worked great for me. And it ended up being a very good experience. I was able to work through my problem and to figure out a solution. So I hope that I will be able to keep an open mind as I continue throughout school and throughout my career when I see patients who are needing certain restorations such as dentures or crowns or bridges, that I may be able to always remember to think outside the box and be able to apply what I've learned in this class. I am going to be making a denture off of this out of something that I found in my home. Obviously you can tell there's some pink on there. I didn't actually succeed on my first try. I tried to use candle wax, but it was too soft. So this time around we're going to see if we can use hot glue. Okay, we have started to place some teeth in our hot glue denture. What is it like to be edentulous? Edentulous patients have a lot of hardships that they have to go through. For instance, they have a hard time speaking, they will have a hard time eating and getting the nutrients that their body needs, and they will also have some problems with self-confidence. Some of the main points that I was able to experience when I did my self-edenture was that I felt uncomfortable being in public with it in. I felt like everybody was looking at me because I was talking a little different. And it's not really a good feeling to feel like you are not as equal as everybody else. Another thing that I noticed was as I was trying to eat, I had a hard time keeping the self-edenture in while I was trying to drink. The fluid actually got up in between my palate and the self-edenture and kind of popped it loose. Another thing was it was kind of hard to talk. After a little while I was able to kind of get a hang of it, but I can only imagine having a brand new set of teeth and having to relearn how to talk and how to pronounce certain words, because you have new teeth that are in new positions that you're not used to, and sometimes if those teeth aren't in the correct positions, you're going to have a hard time saying your S's and other issues with some other pronunciations. Being a dentulous is not easy, and it's not fun, and it's not anything or anybody would ever look forward to it. I know that I definitely didn't enjoy it that much, so I hope that I can help those who have to experience this for pretty much their entire life or for the rest of their life, that I may be able to make it easier for them. This is my self-edenture video. I've been wearing my self-edenture for the past day now, and it's been an experience, that's for sure. I haven't really had any problems with gagging or anything like that, but my problems have been with just keeping it in there, especially when I'm eating. That's probably the hardest part. When I'm drinking, the fluid gets up in between my palate and my self-edenture and pops pops the denture out. Other than that, it tastes gross, but I don't think that's really anything like a denture. But definitely, it's been really hard. I don't think I ever want a denture, and I feel for the people that have dentures. I have a grandma who got dentures when she was 16, and I just don't know how she does it. So it's not fun. Definitely not fun. So various prosthetics include the hybrid denture, which is one that attaches to implants and is the most permanent of all. This one is kind of unique because it has no palate on the maxillary denture, giving the patient the ability to have better taste. Although it is more permanent, it is also the most costly of them all, and requires more space for attachment. But this denture will also give the patient 100% chewing force. Another prosthetic is the overdenture, which also attaches to implants but is removable. These dentures are mostly found in the mandible with 2 implants, and the maxillary with implants there will be 4. There are different types of implant attachments. For instance, there are the ball attachments and the locator attachments. These run about $4,000 to $5,000 per arch, and they only allow 50% of the chewing force. The regular dentures do not have any implant attachments and are the least expensive, but unfortunately they are the most uncomfortable as well. And these dentures actually only allow 10% of normal chewing forces. So with these dentures, patients are going to have a harder time eating and biting into certain foods. Fabricating a denture. The first step is to take an alginate impression of the maxillary and mandibular arches. You need to make sure that you open the jaw wide, move it from side to side, and manipulate the perioral muscles. This ensures that you are going to get a tight fit even when there is movement within these arches. For the mandibular one, you want to make sure that you move the tongue around. After you have these alginate impressions, you're going to want to pour the stone model up from these impressions, and then you will go ahead and fabricate a Wayne Newton rim, which is a combination of a custom impression tray, which you will be able to take your final impression in, attached to wax rims, which you will take measurements for placing the teeth for the denture. The next step is to actually take that final impression. This will be a VPS impression. First, you're going to use a heavy body aquasil. This material you will press flat to the triad for the impression. Right before you put it in, you're going to put a full bead of impression material around the periphery of the triad. After this impression has been taken, you are going to want to make sure you observe this impression. If there are any thin areas in the heavy body impression, you're going to want to apply a less viscous impression material, which allows better flow into those light areas. And you will retake the impression to make sure you get a good seal. After you've taken your impression, you're going to go ahead and mark the wax rims using the Dress to the Nines guide as followed. When determining the components of the Dress to the Nine guidelines, you need to make sure that you look at your patient from camper's plane. This ensures a better outcome of the denture for you and the patient. I'm going to hit on a couple of the Dress to the Nine topics that I felt like were important, that I learned the most from. The first one is the buccolingual position of the maxillary central incisor. This one is important because you need to determine it from the repose position from the side of the patient. It's important in a real patient because if you don't determine this position correctly, you will affect the patient's lip length, and their lips may appear bulky or what we call a bitter beer face. If the position is too far forward, the lip will be short and bulky. I noticed this when I was drawing Heidi Klum's picture. If I drew the position too far forward, it didn't look normal because it fell too far board past that bottom lip. So the perfect position for that buccolingual position of the central incisor is to fall right behind the labial, on the labial aspect of the lower lip. Another component of the Dress to the Nine objectives is determining the zenith line. This can be determined by using the patient's photographic smile, and this, if it's not recorded correctly, will actually give the patient a gummy smile appearance. We were able to experience this on our patient Ross in the live patient experience when we constructed his wax rims and then placed the teeth in. We did not follow the zenith line, and the dentures we all made him appeared gummy, where he had too much of gum showing when he smiled, which made his teeth look really long and further down. Ridge resorption. This is typically due to the lack of stress put on the bone from the tooth and the PDL, which would normally drive bone remodeling. Without the tooth and without the PDL, there is no bone remodeling, and therefore you're going to lose the tissue, and the calcium ions are going to be dispersed throughout the body. Surprisingly enough, the mandibular ridge resorbs 4 times faster than the maxillary ridge, and we typically see a pattern of an individual going from a class 1 occlusion to class 2, then eventually to a class 3. Ridge resorption patterns are as follows. With the mandibular arch in the anterior portion, it's going to resorb down and in towards the tongue, and then eventually it is going to switch and resorb down and out towards the chin. In the posterior portions of the mandibular arch, you're going to resorb out towards the cheek, and on the maxilla, you're going to resorb up and inwards towards the nose. Relining a denture. There are many reasons why a patient would want to reline their denture, one being that the denture doesn't fit as well as it used to. Therefore, by relining the denture, we can make it a more comfortable fit for the patient. Sometimes the main reason why dentures don't fit anymore is due to tissue change and also bone resorption, which can cause a loosened denture. There are many different techniques that we can use to actually reline a denture, one being the slow setting acrylic technique and one being the PVS reline technique. The following slides are steps in how to reline a denture with implant attachments, along with some pictures for reference. Rebasing a denture is where you cut off the entire base of the denture and leave only the teeth. Then you will replace the entire denture base. This is typically done only in lab. Repairing a denture can be done in your own office, and you can use acrylic to repair a damaged denture, typically kind of like gluing it back together. If that doesn't work, you can grind a new hole and kind of mesh them back together. There are several techniques that you can use to repair a denture. Interacting with the patient is a very important part of the actual dental procedure. When Ross and Hermie would come in to volunteer to help us learn, I would try and treat them with the most respect that I could. I would try to show up on time, dress professionally, make sure that I always put on my gown, my mask, my gloves, to make them feel like I was taking care of them. I also tried to explain to them the processes that we were doing as we would do them, such as the impressions or trying in the triad with the wax rims and teeth set in it. Obviously, it wasn't very comfortable, so I tried to kind of portray that. Both Ross and Hermie kind of already knew what was going on, so, but it was good to practice on them. When I have a real patient and I'm actually doing a procedure on them and doing a denture on them, I'm going to be able to look back on this experience and remember how important it is to treat your patient with respect and to show up on time and to be compassionate towards them in their situation. And I feel like they, as the patient, will have a better experience overall at the dentist office with you. I feel there are several ways to improve the edentulous experience of some patients in your office. One way in particular is to take and use the simplified technique that we learned in this class. Not only is it more fulfilling for you as a dentist, but also for the patient. The patient would be able to have a better experience in your office because they will be there for a shorter amount of time, undergo shorter appointments, get more done in one appointment, which also is better for you because you would be able to spend more time getting to know your patient and to getting to know what they need and what their needs are and what they expect out of their restoration from you. Another thing I feel is really important is to communicate with the patient, get to know them, and educate them on what steps you're doing and why you're doing them. A lot of people are curious and are sometimes afraid to ask why you're doing a certain thing that you're doing. If they are curious, get them involved, show them the material that you're using, maybe even pull up a video, show them kind of how a denture is fabricated, what steps are taken to do it, and possibly that will help them understand why it takes so long to do it and why it is so important that you get the measurements that you do and have the full cooperation of the patient. Those are just some of the ways that I feel like are a good way to help improve the experience of the edentulous patient.